what are the pros and cons of choosing gynecology as a PG specialty?
But as gynecologists, what happens that it takes...
What USP they should look inside them that if I have this, I would be a successful OB-GYN specialist.
Indians make the best gynecological surgeons.
In today's scenario, what's the biggest difference or are they equivalent, MS or DNP?
Because the pressures of private patients coming, paying patients coming in, you may not even get to do...
So best places to do SRship for Obs-GYN.
Any government hospital, any state medical college.
Do you think AI will take over in some sense?
AI will take over the...
So what do you think will be the 10-year future for Obs-GYN?
You're asking about a branch which has outlived all the other branches.
How much does an MS OB-GYN earn as a fresher, as a mid-experienced doctor and as a senior doctor, both in government or corporate? 92.7% of you have not subscribed this channel. So I'm getting some amazing views, so thank you so much for that. But guys, 92% have not subscribed. So before I tell you who is the amazing person on our guest hot seat today, I would request you, pehle subscribe karo, phir like karo. And moving on to who is the special guest today, I would say he's one of the best in his field. He is a graduate and a postgraduate of JIPMER and of a very special field. I am saying he has postgraduated in Obstetrics and Gynaecology. Can you imagine that? In our hot seat today, we have the amazing person, Dr. Prassan Vij. He's a specialist in infertility, IVF and advanced surgeries. He started in JIPMER and then studied further in infertility at CMC Vellore, one of the best institutes in our country. He has been a NEET, PG and FMG educator for last 25 years. And I can proudly say he was one of the earliest educators in DBMCI. Today, we are going to discuss about Obs-GYN as a branch, his own personal journey, the possibilities of establishing your own private clinic in Obs-GYN. What are the future specialties possible in Obs-GYN? What are the potentials across the globe and how much can an Obs-GYN specialist earn in India? Get all the questions answered by the legend himself. So let's put our hands together and let's welcome Dr. Prassan Vij. So welcome, sir, to our show.
Hi, Nachiket. Great to be here.
Thank you so much for taking out time for us.
Pleasure, always.
So you are one of the most renowned Obs-GYN specialists in our country. You are an educator for almost last 25 years. I can proudly say you were one of the most earliest educators in Bhatia also. So sir, before we get on to your illustrative life, I would request you to share how you started as an MBBS student. How did you get to choose Obs-GYN as your specialty? Because that's a very rare thing, a man choosing an OBG. So that's
I knew this was coming.
So that's going to be a very special question later in the podcast. And what was your future life like? So let's start with your MBBS life, sir.
Yeah, before that, I would like to say that I'm so happy being here with you, Nachiket. You are part of my family at Bhatia's. This is where I started my journey as a teacher. Sir. And wherever I go and teach and wherever I am now, it's because I started teaching with Dr. Bhatia's.
Thank you, sir.
And this is where it all started. And yes, of course, we are now aligned with many places and many good people. And it's wonderful, this journey which started with Dr. Bhatia's. And every time I come to take a online or offline class with you guys, it's like coming home. And meeting you is like coming home again.
Thank you, sir. Thank you so much.
So yes, I started my MBBS in JIPMER. I was, 17 and a half. And young teenager at 17 and a half getting into MBBS, you can imagine, how we have to get into MBBS and then start behaving like doctors from day one. I mean, like you have a big responsibility on your shoulders to behave like doctors and act like doctors and, have the decorum of being a doctor. But yes, doing my MBBS from JIPMER was one of the high points of my life. And that's where it began, Yes, I got to know understood the culture of reading, the culture of understanding the subject as a whole, not just passing an exam. Because passing an exam, there was never easy if you could never extrapolate from the topic. So yes, that's where I did my MBBS from, and that's where I've done my MD in Gynae from. And after that, while I was doing my MD, I also enrolled for my DNB. So I did my MD and DNB. And of course, the exam of DNB is with the National Board. And after that, I did my fellowship in IVF from CMC Vellore. So that's my journey of education. That's where I've done all my education from the South.
That's great, sir. So how would you describe JIPMER as a college? As an academic point of view, as a discipline point of view?
Look, it is actually the best. Let me tell you that, the culture of reading is matchless in JIPMER. I mean, I was a Delhiite and I was an army officer's son, and we had life. We were brought up as, young boys and girls who had a lot of extracurricular activities going on along with reading. We knew what are socials, and we knew what is the meaning of, doing horse riding as a sport, and, doing show jumping while doing horse riding, and shooting as a sport. I was a shooter when I was in my school days. I was a national champion at that. And when you go into JIPMER, you suddenly realize that yes, when you are a JIPMER, right, the culture of reading gets into your system. It changes your genome. JIPMER lets you do basketball. It lets you play cricket. But the core understanding is that you have to read. If you are becoming a doctor, that becomes your utmost priority. And everything else happens. I mean, I did a number of socials there. I was on the stage all the time. We did so many inter-class competitions, inter-college competitions. But JIPMER builds a character of reading and understanding. And it is matchless. I'm telling you, I've been to CMC Vellore. There's a very good culture of working in CMC Vellore. Yes, CMC Vellore is also I'm proud to have my association with CMC after JIPMER, but yes, the culture of reading and understanding, extrapolating from a topic and understanding the whole subject, that's what JIPMER has taught us. It has taught us to be sincere with ourselves. You're not fooling anybody in JIPMER. You are passing the exams because you understand. You don't have to answer, out of these 10 questions, if you know 5 will pass you. There's nothing like that happening there. You can't say that the drug of choice for postpartum hemorrhage is oxytocin and you can pass the exam. No, that won't happen. You'll have to answer better than that.
So in your experience, what's the biggest difference you can find between AIIMS and JIPMER?
Well, I would have enjoyed working in AIIMS, but yes, when I came to Delhi, I realized that AIIMS is such a big place that because of the sheer enormity of that place and the number of doctors they have, the individual attention of the professors on you is lacking. I mean, it's again a matchless institute. It's the biggest institute of the country, and the number of AIIMS bodies are there. They have a very good reading culture. They have a very good research culture, just like JIPMER has. But I feel the JIPMER, they were teachers holding my ears when I was not answering well.
I can understand, sir. So JIPMER is basically a very caring institute, I would say.
Yeah, it is. It's got that personal attention. And that stems from the fact that the number of students taken in are not as many as other institutes.
True,
so
sir.
even in the MBBS level, they have a lot of personal attention.
So, sir, I'll get to the question here. I think the landmark question of our today's podcast.
Why did you take gynecology as a subject?
I know. Why did you take gynecology?
You're branded. When you're an intern, you're branded. ये तो surgery करेगा. You're a surgery pananga. I mean, that is in Tamil. He's a surgery guy. He's a medicine guy. Broad categories are defined in internship. And of course, they looked at me and he said, this guy, he'll read less, he'll run around more. He runs so much that I was, you have to start running in internship. That's the first thing which happens. So if you're running fast and you're making sure that you're going for the casualty, at the same time you're collecting 3 X-ray reports, and at the same time you're taking the samples from the ward and given to the path lab, and then you're seeing the casualty emergency. If you can do that fast, he's going to be a surgeon. And if you're doing it and making sure that somebody else does half of your work, he's going to do medicine. So I was branded as a surgeon. And of course, my first choice was surgery. Second was gynae. And I had some medical issues when I was doing my entrance. So yes, when I got my choice of gynecology, there was no looking back. I said, yeah, that's my choice, one of my choices. And JIPMER, we don't think twice. Either you're doing, if you're a surgical bent of mind, you're doing either surgery or doing gynae. You'll do next probably ENT in your list. You may even think of ophthal if you're surgical. Orthopedics doesn't come in a general surgeon's list of things. Orthopedics are totally different breed in JIPMER. They think only ortho. They'll do diploma ortho, but they'll not do any other subject. But a surgeon bent of mind will do. So yes, I got gynae. I was very happy. I got into gynae, and I was very happy that I took that subject because it's an end specialty. You can start being a specialist within 3 years. Surgery, yes, surgery. Is if nothing works, then surgery works. We always respect surgery. So that subject has its own charm. But then gynae is that one subject. It's got limitless possibilities. It's a very satisfying branch. And it's one of the branches where you do a lot of medicine, a lot of surgery, and then you do obstetrics. And once you start liking obstetrics, it's the best branch a person can do.
Great,
I'm very, very proud of the fact that I'm a gynecologist.
So, sir, in today's time, you are a practicing OB-GYN. So, if I ask you, what are the pros and cons of choosing gynecology as a PG specialty, what would your answer be?
Very rewarding subject. It's a happy ending department. Either you're having obstetrics at your hand, you're having a hysterectomy at your hand, you have a big tumor to remove, you do it open, you do it laparoscopically. It's a very rewarding branch. It's a happy ending department, let me tell you that. Very satisfying. Most days we are happy. Yes, we have our dejections, we have our own cases where things go wrong. But then yes, versus other subjects, it's a very rewarding subject.
Sir, any con?
Yes, it's a very busy branch. It's a very physical branch. It takes the Jimmy out of you if you're not very physically fit. I'm telling you that. Don't take gynae because you have to take gynae. So that's where the question which you answered, that why being a man you decided to gynae? Because yes, women are the fairer sex, they are the smarter sex, they are the entrepreneurs, they are the homemakers, they are the CEO of corporate companies. Everything, women are better than men any given day. But as a gynecologist, what happens that it takes a whole lot of physical effort to do this subject. The nights when you don't get to sleep at all, you can manage in your PG life, you can manage in your SR-ship life. But then, ultimately, you have to take care of your family. So that's where it becomes very demanding. Where I feel that it's a branch which is physically demanding. So that's where I feel that, okay, fine, the cons are there. Because if you're not physically fit, yes, you have the liking for the subject. So that's the con where it is a very physically demanding branch. And all the happiness which is there with the results, the balancing act is that it gets frustrating when 2 a.m. in the morning when you're working and you've not probably had your lunch also, forget your dinner. And you're expected to perform at 2 a.m. in the morning. You have to take care of patients who are in pain, patients who have come bleeding in the middle of the night, ruptured ectopics, bleeding CS services. So it's limitless amount of work, even any given moment of time.
So, sir, if a student wants to take up OBS-GYN as their PG specialty, what USP they should look inside them that if I have this, I would be a successful OB-GYN specialist?
You have to think of a long-term responsibility of loving that subject. You cannot love the subject in your internship and say that my parents asked me to do gynae because I have a hospital to run and ultimately I have to do gynae. You can't take it for that. If you're taking it just for that, please, become a ENT specialist or maybe a ophthal specialist in your hospital. Because if you have a responsibility of doing gynae because your parents are gynecologists and your hospital of gynae, and then you're taking it, or because your husband is a surgeon and you have to be a gynae, please don't take it for that. That is the last thing you should be doing.
So you have done both PG and DNB, MS and DNB.
Yes.
What's in today's scenario? What's the biggest difference, or are they equivalent, MS or DNB?
Anybody who is going to be a gynecologist or any other specialist in this country, my advice is plain and simple. Please take the MS. Please take the DNB, whatever you get first. Don't waste your time writing the same entrance twice or thrice to get the MS in the best college in the country. Because your PG is, let me tell you, a degree. Some places may give you surgery, some places may not give you surgery. But ultimately, what you do in your SR-ship as a surgical subject, SR-ship makes you a surgeon. In your PG, you learn. In SR-ship, you get your hands into blood. And if you are not doing SR-ship and straight away going for super specialization, then do medicine. Then do medical subjects. If you're a surgeon, you're signing for the long haul. And you cannot say that, okay, immediately after surgery, I'll do this super specialization, then I do this, then you'll be a very limited surgeon. Same goes for gynae.
Great
So
point.
yes, you have to be ready for the long haul, and whether you're doing DNB or whether you're doing MS, it doesn't change much. It's just that you have a fixation that I'm not doing MS, I'm doing DNB.
Which would be the top 5 institutes for MS OB-GYN in our country?
So if you're talking about names, let me tell you JIPMER first, because that's a common place. And you can think of KEM in Bombay, you can think of Sion in Bombay, you can think of KGMC in the north, and LHMC, MAMC, wonderful places to do your gynae from, if you want to talk about the top 5. But I would say any state capital, the government colleges.
Top 5 institutes for DNB OB-GYN in our country.
If you ask me DNB institutes in our country, I would always say go for St. Stephen's Hospital. It's like if you want to do MD/MS, you want to do it from AIIMS and JIPMER. You want to do DNB, you want to do it from St. Stephen's Hospital. Because you get to do a lot of surgical work. If you're not doing surgical work, then it is not worth doing surgical branch in. So that's why we say St. Stephen's Hospital, we say Army Institute, the Army Hospital, the Northern Railway Hospital, St. Philomena's Hospital in Bangalore, even Kasura Hospital. These are some institutes where go for missionary setups, go for government setups where you're getting DNB degrees. I would say avoid corporates because the pressures of, private patients coming, paying patients coming in, you may not even get to do much beyond an episiotomy. So that's what I feel, that you should avoid corporates as far as possible. Of course, you get a very comfortable PG to do in those places. The backup these hospitals have, the investigations you can do in all these corporates, these are matchless. So yes, you get a more complete experience in corporates, but your surgical acumen is limited.
So best places to do SRship for OBS-GYN?
Any government hospital, any state medical college, wherever you can put your foot in a state medical college. It doesn't have to be the capital. I mean, if you are from Rajasthan, you don't get it in SMS Jaipur, go and do it in Kota, go and do it in Ajmer, do it in a government hospital. If you want, and please, I'm repeating this many times, that do not get into laparoscopy specialization or infertility, IVF, don't get into fetal medicine till you do your SRship if you're a gynecologist. Without SRship, you're wasting your time because you'll be a half-baked surgeon, you'll not do much open work, and then you'll want to do laparoscopies where you'll never excel till you've done enough open work.
Sir, if a student wants to basically judge a college or an institute, whether it's the right fit for OBS-GYN, how should that student judge an institute? What should be the parameters?
Now, the institute where the foot falls, they should be doing at least 300 deliveries in a month.
Okay.
Until they're doing 300 deliveries in a month, you're not getting much chances to do. Otherwise, if there are only 50 deliveries happening in an institute and the consultant's barely having work, so find out number of deliveries. Don't go and ask how many hysterectomies they're doing. You're not good for a hysterectomy in your first year. When students come to me asking, sir, can I join Stephens because हमने सुना है यहाँ पे hysterectomies मिलती हैं. I said, please, you won't get hysterectomies till your last month of your last year of residency. You may get it, but that is not the criteria. The criteria is that how many cesareans you get to do. Criteria is how many deliveries you've done and how many episiotomies you've done without, making hematomas in the vulva. So the criteria is the number of deliveries. If you have many deliveries, you'll obviously have those same families coming for hysterectomies, and the same patients will also come for laparoscopy work in your hospital. So criteria always the number of deliveries. And of course, then look at the labs. If they have a CT scan, if they have an MRI machine, even better. So go for setups where I have all this. Don't go in. I mean, the only criteria which students ask me, even those who want PG counseling on the phone, they ask me, sir, hysterectomy kahan milegi? Nobody is going to give you hysterectomy. In fact, in Delhi, when you're doing SRship, they make it a point that you get your hysterectomies, maximum hysterectomies in the third year of your SRship. So that in the first 2 years, you're doing the regular core obstetrics work.
So what are the super specialization or potential opportunities after PG OBS-GYN?
Oh, there are so many now. Of course, you have so many now that that's why I keep saying it is the best branch to do, because you have infertility, reproductive medicine, then you have laparoscopic surgery as a super specialization, then you have urogynecology, you have fetal medicine, you have high risk obstetrics. So the number of things you can do after being a gynecologist, they are limitless.
What's the super specialization that is going on right now?
I would say IVF always, reproductive medicine. But again, it comes back to the same experience. I am a reproductive medicine specialist. Yes, I love my obstetrics the most. I love putting forceps the most. But since I've done so much of work in obstetrics and I've done so much of general gynae, I am not just doing IVF. I'm also doing the corrective work which is required to take a patient to IVF. I have many friends who are doing just IVF. For surgical work, they call a general surgeon to do the corrections. For taking out you have to do some corrections. Suppose you have a septate uterus, you have a fibroid uterus, and you have a submucosal fibroid. You have to correct all of those things and then make the patient good for her fertility. Now, the surgical work is done by somebody else and you're doing just the IVF. So, you've done an IVF super specialization immediately after your MD. That's where you become just an IVF specialist and not a reproductive medicine specialist. So, that's where the difference is. So, that's why I always say it comes back to the same 3 years you put after your MD. After MD or MS, the 3 years which you put.
So, what do you think will be the 10-year future for OB-GYN?
The future of Obs and Gynae, you're asking about a branch which has outlived all the other branches. जब तक इंसान है तब तक Obs and Gynae है यार क्या बात कर रहे हो? तो फ्यूचर तो इसी सब्जेक्ट में है.
Do you think AI will take over in some sense?
Yeah, AI will take over the decision making. There are people who are doing robotics. And, if you know your laparoscopy work, robotics is an extension of that. You have a much better instrument doing the same work. Ultimately, it's going to come to what is your clinical acumen. People said that when computers came in, it's going to replace everything else. But computers are there. They are making our work easier. But the number of people getting jobs because of the computers have increased manifold. So nobody has lost their jobs because computers came in. So when AI came in, initially it appears that, okay, it is going to take over the number of jobs and we are going to be jobless and AI is going to take the decisions. Yes, ophthalmologists, they make the decisions, but AI will help them make a correct decision. We are happy to have that tool with us. I know the side effects of loperamide when I'm giving it to a patient for diarrhea. But yes, when I look at Google, it helps me to know the rare side effects which I don't remember at hand. But that doesn't replace my knowledge of treating diarrhea. So yes, these are helpful tools. It's going to be there. Ultimately, 10 years from now, you will be talking that computers came, now AI came. It has still, we have outlived all of these. I'm telling you, 10 years from now, you have a podcast again with me, you'll be telling us the same thing. It's not going to replace the brain behind the person who made the AI, isn't it?
Sir, apart from India, of course, Obs-GYN specialist, what is the potential and opportunities in the outside world? US, UK, Australia?
Now that's a question which is very easy to answer, that if you want to be in US or in UK or in Canada or New Zealand, you have to do their specialization. And there, I would always say that if your primary motive is to go and settle in these countries, then do it immediately after MBBS. Go there immediately after MBBS, write their entrance, do your MRCOG or do your USMLE and work for these specializations there. You cannot do MD or MS in Obs and Gynae here and then say that UK will give you a job. That happens, but that's very rare. There are few surgeons, gynecologists who've gone like that. But mostly you'll have to go and do their specializations. So yes, if you're an obstetrician here and you've done your MD from one of the major institutes of the country, especially JIPMER, AIIMS, Maulana Azad Medical College, if you've done from these colleges, then you are required much more than the places where maybe you've done it from some other colleges. But let me not say, if you're an MD from India, you are required in the Middle East, you're required in many other countries in the world where you can be much more comfortable in your financial emoluments. Yes. Definitely the Arab Emirates are a good option, and you can go to the African countries, you can go to the South American countries. But yes, Canada, US and UK, you have to do their specializations.
So do you think that 10 years down the line, a simple post-grad in Obs-GYN would be able to find work?
In the peripheries, definitely. In the smaller states, definitely, they'll have enough work. But yes, in the major cities, you'll have to have something which is different from being a basic Obs and Gynae specialist. You have to have your laparoscopy skills, so you should be doing ultrasonography at least, or you should be doing some high-risk obstetrics. You cannot, in Delhi, Bombay, in Hyderabad, Bangalore, you will not have much of a place to run if you are having just Obs and Gynae as a specialist. You must do something different. But yes, you will have enough and more places, because there is a demand for Obs and Gynae at any given time. You know that very well. This branch has outlived all other branches.
So now the favorite question of our audience for this podcast, and it's going to be very simple, sir. How much does an MS OB-GYN earn
Okay.
in his lifetime?
To the,
as a fresher, as a mid-experienced doctor and as a senior doctor, both in government or corporate?
So if you're a postgraduate in gynae, you're earning upwards of 80,000 rupees per month. If you're an SR, you're earning upwards of 1.5 lakhs. I mean, every year for the 3 years, you're getting more and more money. And when you're a consultant in government, it's upwards of 2 lakh rupees. And it's a very good, decent job. You get a lot more opportunities as a government worker. I mean, you will get allowances to do research. You will get sponsored trips to outside conferences. You can present your papers and the government helps you. So that's a very comfortable job. Now, you get into private, if you have a decent practice, you are upwards of 4 lakh rupees a month. If you have a decent practice. And when you are beyond 10 years of your experience, then upwards of 6 lakhs rupees is your practice. If you're an IVF consultant in the private, then my friend, sky is the limit. Then you're upwards of 10 lakh rupees per month. If you are a decent IVF specialist. So laparoscopic surgeons, upwards of 8 lakhs to 10 lakh rupees a month. That is after 10 years of being in the subject.
And what about tier 2 and tier 3 cities, sir?
Yes, those will not be as much, but then you'll be very comfortable. You'll be in a place where you'll always have work. Probably for reaching the same amounts which I told you, you'll have to do a little bit more work. But then tier 2, tier 3 cities also are giving you, enough because the costs are less. So you will eventually get there. Your lifestyle, your comforts will eventually match with probably a little bit more of work.
So what are the business opportunities in this branch?
You have to have the business mindset from your postgraduate. When you're doing this post-graduation, you must decide that, okay, fine, I'm going to make my own hospital and I'm going to have a chain of hospitals and I'm going to be investing this much and getting this much of investment from these companies, and I'm going to start a chain of wellness care during obstetrics. I'm going to advertise normal vaginal delivery. Everybody's talking laparoscopy, everybody's talking robotics. So normal vaginal delivery. A person advertises that we have a proper launch for getting you to get into the exercises before going to labor, and we make sure you deliver normally. If there's an emergency, we do a cesarean. So normal vaginal delivery, and having a chain of hospitals doing only that. You have all the exercises, you have the music, you have everything for that. You decide from your post-graduation that I'm going to advertise that. Or you decide that I'm going to open a chain of IVF hospitals. I'm going to have 4 centers in all the 4 corners of the country. Or you're planning to do dedicated laparoscopic work. So you're going to give robotic work in all the major cities in all the states. You have to have, and this is what is, because there is no dearth of patients in gynae. You can have a chain of hospitals, and with minimal investment, you can start with 1 center. And we have seen people grow from 1 IVF center having a chain of IVF centers within the same city, 4 centers with the same concern, and then across the country.
True, sir. So let's talk about your residency days now. I believe, sir, being a man, you chose a field which is basically a female-dominated field. So did you face bias during residency days?
Look, I'll be lying if I say that I never faced any refusal and I never faced any bias against me. Please, it does happen, but it is not as bad as it seems. There are hundreds of boys who have taken gynecology, and some of them have taken because of me also. I'm proud to say that. But if you're a good person, if you're a person who has got his mind at work and who can see a woman for the patient and not because the person is a woman, and if that distinction comes very early, then the patient knows. Once they know that you're a good doctor and a very dedicated worker, then you never have a problem. See, when I was in JIPMER, when I started my MD, there was hardly any problem because men and women are equal number. In fact, before me, the batch, they had more boys than girls in the post-graduation. We were 50-50 when we came. In 6 of us, we were 3-3. But we always feel that coming to the north, it might be a big thing. But coming to the north, yes, it took me around 2 or 3 months when I started working in St. Stephen Hospital. And in 3 months, there were patients thronging to my OPD. Although I was not a consultant, I was an SR. I had my own set of patients coming and showing me only because you're a dedicated worker. So, yes, there is a limited amount of hesitation. And of course, you must give the woman her choice. I mean, if she's more comfortable with the lady, that's her choice. But it's way beyond the days when he said, why will I show a man? Why will I show a man? It's not that you're showing a man. I mean, if you have a surgical problem, are you looking at that person as the doctor as a man or a woman? If you have an orthopedic problem, are you looking at that doctor as a man or a woman? So these things are just that initial thing. It's just that it's gynae, then why should I show a man? So that thing is not driven by the patient. It is always driven by the relatives. It is actually never the husband. It is always, I'm saying this on record, but it is always the mother-in-law who will have a problem. The patient rarely has a problem. The patient is always very happy coming in, showing to who is a good doctor. And God has been kind to me. It took me 3 months, which I think any doctor takes 3 months to establish. Even I'm very sure a lady who's a gynecologist would take 3 months to establish in any new place. So when I came and started working here, we had, God was kind, and I had my own set of patients coming to me, and I've never looked back. And yes, I'm very busy at work, and thank God for that. So I don't think that is not a limiting factor. If you're good, you'll get your patients.
So how were your residency days? Like, did you feel any toxicity in your college?
Very busy. The toxicity is not because you're a boy or a girl. The toxicity is the number of hours you put. I don't know whoever's listening to this, and there are some postgraduates obviously listening to this. Most hospitals now have a system of a post-duty off. We never had something like that because our professor thought that hard work never killed anybody. And today, looking back at those years when we had winkless nights, I mean, sometimes we used to have a rota. My friend PG, the second day PGs, both of us are the busiest. Okay, I'll sleep for 2 hours, you sleep for 2 hours. And that 2 hours, if you sleep, it is like, wow, man, duty pe 2 ghante so gaye. But later now we're realizing that the number of hours we put in those nights, that has worked to our benefit. I mean, like, I can never say no to any case which comes my way. You can call a patient for a tumor. You can call me for obstetrics. You can call me for IVF. That kind of work we have done. So yes, it is very toxic. I mean, it is very hard on your body that you've not slept. You started in the morning and you're going next day evening at 5 o'clock after seeing the pre-ops and getting the anesthetist to do the PACs in the night. So after that work, sometimes you have to go and do your thesis work. And that is also a big challenge when you're working so hard. So yes, it gets very toxic. Yes, the toxicity is not only of that. There are some professors who may like you, some professors may not like you. All that is also part of the deal. So you have to make sure that you're working very hard. And if you're working very hard, everybody eventually likes you.
What would be your advice to a new JR1 in OBS-GYN who is going to enter into a college, and how to deal with the toxicity, how to deal with the work stress, the mental pressure, and how to be physically and mentally healthy?
Look, I'm telling you, if the doctor who is doing gynae or surgery, these two branches I can vouch, don't do if you're not physically up for it. It is a very demanding life. You have to go in the morning at 8 and you have to finish your rounds before 8 because the consultants are here at 8 in most medical colleges. And you're doing rounds. And then you have to work in your OPDs. And then evening you're taking up the emergency work. And the whole night you're operating. And next morning you have to do your OPDs again. Or you have to do your OT next morning. So it's a continuous spiral of work. And if you're not physically strong, I'm again saying don't do gynae or don't do surgery. Be up for it, because the more you work and the more you're up to taking challenges at work, only then the consultants realize that, okay, fine, look at this guy, he's doing everything which is required of him. And besides this, he's doing his thesis work, he's doing his presentations on time, he's doing his thesis work, and he is up for more challenges. He's taking more responsibilities. So then the person thinks, okay, fine, chal yaar, isse to hysterectomy aur kara dete hain. Yeah, maybe this person is good to go and speak in a conference. So you will get rewards if you're working hard. Like I'm always saying this, Dr. Nachiket, there is no substitute for hard work. And hard work has never killed anybody. In my professor's words, hard work has never killed anybody. So if you're working hard in these two subjects and you're up for more challenges, as a first CPG, don't think of getting मेरे को cut नहीं मिल रहा. मुझे मतलब surgery वाला, my friend from PGI Raimya said, यार, I'm not getting to even hernias in JIPMER. We did hernias as interns. Now I'm not getting to hernias. After doing his MS from PGI and doing his super specialization, he's got limitless work. He's one of the richest guys I know. He's got so much work. And I keep pulling his leg. I said, look at you. You were always gripping that you never got work. So first year, second year, think of how much of work you can do and how you can manage patients for your consultants. Then I'm telling you but be up for the challenge, physical challenge, mental challenge. Most of us, once you become PGs, to get into PG, it's a big line. So mentally though you're strong, you have done your reading big and you have got into the entrance, you've topped your entrance, you got into a good college. Mentally you are strong, but physically if you're not strong, then you may not become a good surgeon.
So, but do you think that we are glamorizing inhumane work hours by calling it hard work?
There is a very good point you brought up, Dr. Nachiket, that if you're working hard, there should be a time limit to it. Set at, the bar is 48 hours for humans, and for superhumans it is 72 hours. We doctors are working 100 plus hours in a week. So I would never project that. If you're working 24 hours, you should get an off. Yes. If you're working 12 hours, you should get an off, but 24 hours between, you should get a full day off. If you're having the workforce for that kind of arrangement, then it's the best place to work. But most places don't have, Dr. Nachiket. Don't blame me for saying that. But those who do this kind of work, they become better surgeons. I mean, you can say, Dr. Vij, you're saying that if you work hard, then you get more work. And yes, if you have a culture where 24 hours and an off, I think that's the best. If you get that someplace, maybe that should be a parameter for choosing a post-graduation.
So, if you could, what would be the 3 things that you would change in the whole system to reduce toxicity and stress for our JRs?
I would want the thesis to be more practical. I would want the thesis to be related to the work which you're doing and not exorbitant topics which are given just for the... I did a thesis which was PhD level thesis when I was doing my MS, and it was tough. So one is that. Number 2, I think the number of working hours should be, the bar should be set at 72 hours. 48 hours for regular people in this world, 72 hours for people who are working around the clock. If they are working like that, 72 hours. And compensation, if you're making them work 72 hours, you should compensate with a similar amount of off hours. And then, of course, you should have directed counseling, how to manage your postgraduate life. That part is missing in most of our colleges. Mostly they are hell-bent on finishing your targets, finishing this, finishing your thesis, finishing this work, and then after that you're on the road. So yes, you should nurture your students, you should see what is good in the student, and that counseling should start in the last year. The final year should be having those counselings where, okay fine, you would do better as this kind of a person later in life. That is what is missing. Because postgraduate life is mostly work-oriented. Counseling for what you're going to do beyond this postgraduate life is not there. That's what is missing.
So going a little bit off topic here. So while we are doing our research for this podcast, we came to a little bit of data that maximum number of malpractice suits happens in OB-GYN. Up to 85% happens in this branch. Now, what are the 5 things that you have seen around you in your hospital, of course, that you think people are committing a mistake while a practicing doctor is making a mistake, and it can actually eventually lead to a suit? What are those 5 things?
All of us are prone to do mistakes. If you're doing a surgery, you may end up with some cuts on the baby's face when you're doing a cesarean. You're doing a surgery, patient bleeds to death. All of these things can happen. So first, document your procedures. Always documentation has saved most people who have been sued and have ended up in major litigations and have paid a lot of money. Those are the ones who have not documented their work well. So always document why you're doing this surgery. Always document why you're continuing this pregnancy beyond this time, or why you had to terminate this pregnancy. Document. And have the knowledge, have the research to support your decision. If you're doing that, then that litigation bit is gone. Number 2, the major litigation comes when you're doing something which you're not trained for. You're doing laparoscopic hysterectomy when you've done 2 open hysterectomies, that too one was assisted. And you start doing laparoscopic work. That's where when you end up injuring the ureters, injuring the blood vessels, and getting into litigations. Number 3, people are always very much in a hurry when they're discussing with people. Patients were coming and, okay, aapko ye karna hai, you have to get your consent done, you have to go to that place, get your work done in the OPD, get your results done from the lab, and after that go to PAC, and the patient next thing is in some other hospital. Or if you have not spoken to them well, and if something goes wrong, again you're in soup because of that. So counsel your patients well, spend your time. If you're not counseling well, then you're in major problems post whatever you're doing with them, whether it's IVF or whether they're doing laparoscopy, whether they're doing a normal delivery.
So the reason I got this topic in the middle was that do you think that those overworked residents or doctors after 36, 48 hours of duty are prone to more mistakes than other doctors or maybe just other people? Because I think OB-GYN is the only branch where you have to save 2 lives. There are 2 humans involved at every point. So do you think that if those people could be simply not be overworked, they would lead to less mistakes?
That's a very logical point. And I would always say that maximum person should work is 12 hours. And if you're pushing that person, it should be 24 hours. It's very difficult to take a decision that you can take it with a fresh mind. That is very, very logical. But then I have seen this life and I have worked these hours. Surgeons and gynecologists get used to working when they are stretched. They're used to this. But between you and me, I would always go for a 72-hour working week for even an active branch. So obviously you do more mistakes if you've not slept. Your hands tend to lag, your suturing skills tend to falter. You may do more mistakes when you're not slept properly. So that goes without saying. But it has not happened with us. That doesn't mean it won't happen with somebody else. Of course, you're prone to do more mistakes if you've not had your proper break from the working hours.
So let's talk about NEET PG. So NEET PG 2025 is going to happen very soon. The date is of course uncertain. Uncertainty is going to loom upon us for like next 4 to 5 months. So what would be your advice to a student who is basically now in the revision mode for the exam? What would be your revision strategy?
Please limit the number of books you're reading. Please don't buy new books now. Whatever you've done is good. You've been with Bhatias, you've been with Prep Ladder, you've been with whichever company which is giving you offline, online classes. Whatever you've done, it's enough. Please listen. If you've been working for the last 6 months for this, of course, if you're starting now, then I'll answer that separately. But if you've been reading for the last 6 months, you've done good to do your first reading. Now, please revise from your notes. Don't buy new books. Please do the number of questions which have come in the last 3 years, definitely, preferably the last 5 years. Don't let any topic be missed. If something has come in the last 3 years and you've not read that, then you're doing a disservice to your preparation. And please, what is happening in the world? I mean, obviously you're going to get questions on the plague if there's a breakout of that. You're going to get questions on corona if there's a breakout on that. Please look at the pamphlets which are given in the hospital. Some new procedures have come. You visit a hospital and there's a new procedure which has come in that particular hospital. They're talking about, let's say, HIFU for high intensity frequency. So be on the lookout for pamphlets which are there in hospitals. Like there is a pamphlet for HIFU, high intensity focus ultrasonography for fibroid management. You should see that pamphlet and make sure that you know that topic, because something is going to come about latest techniques. So don't miss out on the latest which is there in the market already. Please definitely read the last 3 years to 5 years questions and never miss out on the topics which have come in the last few years. Stick to your notes and stick to one book of reference. It could be your notes from the institutes where you've done your training from, or it could be your favorite book from your MBBS days. But please stick to one book, because you may have, let's say, you may have 90% of the information which is required, but that is 90% correct information. The same information you try, oh no, that institute is doing much more rounded teaching, and let's go and read the notes of that institute. You're going to undo the good you did with this institute also. So please trust your teachers who have taught you. Always do that. Trust your teachers, because this is not the moment to, switch your boats midway. You're about to reach the end of your journey. You're reaching the ultimate exam, which is going to give you the seats. NEET is what is going to give you the seats. AIIMS is going to give you a good rank, feel good kind of exam it is. You did well, fine, maybe you don't get the right seat. But NEET is what is going to give you the seat where you're going to do. So don't do mistakes of changing your reading pattern now. And try to sleep at least 6 hours. I mean, it would prefer you do 8, but 4 to 6 hours of sleep definitely when you're doing preparation also.
So how many revisions do you suggest?
At least 2. At least 2 revisions of whatever books we discussed. Whatever you're reading, at least you should do twice. And after that, there is if you're doing the basic revision of all the major subjects, the scoring subjects, you must revise more. Like OBS-GYN, medicine and surgery. If you do a very good revision, you've done it twice, you do very well. Out of 40, you're going to get 30, 35 marks. If you do very good, 36 marks. even if you don't do the third revision, you've done only one revision of OBS-GYN, medicine and surgery, you will still get 25 to 28 marks because you've done that. But if you're not reading your biochemistry, your ophthalmology, your PSM, and your forensics, psychiatry, if you're not reading these 5-6 subjects, then you're not going to get a good rank. So yes, the big subjects will get you the basic marks. But these smaller subjects, see, ophthalmology, if you've not read, biochemistry, if you've not read, you get 0 on 12. If you've read those subjects properly, you get 12 on 12. So the smaller subjects, if you're ignoring, that's where you're losing your ranks. I mean, I hope nobody is advising you to read, okay, out of these 19, you read these 12, you'll get good marks. Please, if you're getting with that knowledge for your NEET PG, then you've been misinformed. You must do all the 19 subjects, and the smaller subjects, more revisions. Bigger subjects, if you can revise, because bigger subjects are going to take the bulk of your time. So last 1 month, all your smaller subjects, you're doing multiple revisions. That's what is going to give you the rank.
So let's talk about FMGs. I believe FMGs are some doctors in our country who are treated differently at every moment. Very, unfair laws and rules for them. So do you believe in that particular thing, that our country is itself treating FMGs very differently? सौतेला व्यवहार जिसे कहते हैं, वो किया जा रहा है उनके साथ?
Well, you have a very, very big point in that. I was seeing them in the initial few days when I came to Delhi. A lot of FMGs came to our country, and thank God that we have this MCI entrance. Look, let me tell you very frankly, till this exam happened, they were not being very sincere. Maybe at the cost of a few of my senior friends getting a little disturbed with this. But now, thank God to this exam that people have realized the value of reading wherever they were, not taking their studies very lightly, because we don't know how they've been taught in all these countries where they're gone. I'm sure they have a good system. Wherever we've gone to take foreign classes, I've seen their hospitals are very good. I've seen their labs are excellent. In fact, some of the government hospitals there are better than the private ones we have in India. Their setups are nice. But once you pass the exam there, and when you come to a country, we don't know how the exam was done, how much you've been, how many clinical cases you've seen. Some colleges where the classes are being done, they don't have attached hospitals. So we won't know the hundreds of colleges, what is happening, what kind of teaching they're having, what kind of cases they have seen. So since we don't know about them, it's excellent that we have this exam. Yes, there was only 5% result in the initial few days, 2007, 2008, when I started taking the classes. The result was just 5%, it stayed there. But now you look at the Jan result, it was 30%. So it's the same students who are going out. Many more students are going out. But the pass percentage has gone up to 20%, every exam to 30% sometimes. So that's because everybody is reading. Somebody is having some app, or their teachers going from India there, and some students are keeping a tab on what is happening in our country. So FMGs, now, for the last 6-7 years, they're doing so well that there are very decent competitions for the people. I sometimes tell them that you already passed the MCI exam, so you've done one exam more than the people who are writing the PG entrance in India. The Indian students who've done MBBS, and now the next exam they're going to write is the PG entrance. But they have written an MCI entrance, which is on par with the PG entrance. And then they're writing the PG entrance. So I feel these MCI students have now come of age. They have now... So many of my students are surgeons, so many of students are now pathologists, so many of them are microbiologists, so many of them are now gynecologists, they're professors in institutes. There was a girl who called me last day, she said, "Sir, where is gynae best? Should I join MAMC or should I join LHMC? But I'm a South Indian, sir, I would prefer doing CMC Vellore." I said, "You're talking to me that you're getting these branches as if it's your choice?" "Yes, sir, I've got 84 rank. I'm not sure it was 84 or 94, but there was a girl who was in the top 100 who was an MCI student, who was one of my students in one of these places. She was a top 100 ranker, and she could pick the choice of this place where she wants to do MD. So I was so proud. So yes, MCI students have now come into their being. They're doing well. And please don't underestimate yourselves. Now, that's my message to them. Never underestimate. Yes, you keep telling me that, okay, when they become interns, they're treated as like one type of doctors. They're called the Russian doctors. Even if he's done his MBBS from Philippines, he's called a Russian doctor. So yes, I know this is there. I know this happens, and you know, and I know it. But these people are doing excellent now. I'm very proud of them.
Sir, any advice for the upcoming FMG exam?
Please revise as much as you can. Stick to the last 3 years MCI questions and the INICT questions. If you can do PG, I'll be happy. Last 3 years MCQs of your favorite teacher. Whoever has taught you, their MCQs, I mean, most of us who are their teachers, I mean, you can pick up any gynecologist, any surgeon who's taught you. Your favorite teacher, stick to their notes and their MCQs from the YouTube. Because most of us are solving the questions free of charge for you on the YouTube. So that's, let me, at the cost of advertising YouTube, please go ahead and see all your favorite teachers MCQ solved, and don't get into any more system of MCQs. Don't pick up a new book, and please read the small subjects. Please read all the small subjects.
Sir, last question before we end the conversation and move on to rapid fire. And this is basically more of a OBS-GYN private practice. Sir, how much time and investment does it require to establish an OB-GYN practice?
3 years. You have to have if you're starting afresh and you don't have a father figure, you don't have a godfather who has a set up practice. So on your own, you should have the patience of 3 years at least. Go slow, have a job which is giving you regular income, and have the permission to work on your own setup. Don't start up a shop and you expect that 15 people are standing in front of your door. I mean, if there's a requirement in a small city, there you may do this. But if you're in Delhi and you want your practice to start going into, stratosphere immediately, that is not going to happen. So give yourself 3 years and you make the system, you make your place. We always say, learn extra skills and then get into private practice. Just being an obstetrician, just being a gynecologist who are doing regular, deliveries is not going to be enough in private practice in Delhi at least. So give yourself 3 years and work for an institute.
And what would be the financial investment?
It has to be upwards of having your own place, and your instruments and your OT investment should be at least 20 lakhs to 50 lakhs. You have a decent OT, then only you should have your own private practice, and you should have the guts and gumption to manage complications. If you cannot manage complications, or you should have the wherewithal to somebody to be available with you to manage a complication. If you're able to do that yourself, then that's the best. So you should have your own OT, get an MTP certificate from the government, and then only start your practice. In 3 years, you're going to be doing extremely well.
Great, sir. Thank you so much, sir. With this, we come to the end of our conversation and we move on to our rapid fire round. It has
Ready for it.
Very simple rules, sir. You have to be spontaneous and you have to be super truthful with us. Sir, let's start. Question number 1. Morning workout or evening stroll?
Evening stroll.
Favorite whiskey?
Jack Daniels.
Do you prefer reading books or watching movies?
Watching movies whenever I get the time.
While traveling, music or podcasts?
Music.
So beaches or mountains?
Anytime beaches.
Favorite car?
Jeep. Compass.
Saw the red one. What's your favorite holiday destination?
It has to be Mauritius.
Okay, I know you love Mauritius.
It's because I have a wife from Andamans. So it has to be either Port Blair or Mauritius.
Sir, more time or more money?
Time. Money will follow.
What's your favorite pastime?
If I get to sleep, I love sleeping. I get to not get more than 3 hours a night.
So what's the best gift you have ever received?
786 rupees from Dr. Matthew Varghese. He gave me a payment for something which I did for him. And to know Dr. Matthew Varghese, you have to understand this. Dr. Matthew Varghese is the stalwart of orthopedic work in the world. And I did some work for him. And he insisted that he should pay for what I did. So he won't get it courtesy done by anybody. So he paid me that. And I have kept it in my safe forever. I have not used that money. So I think I am getting a steady income because I have those 786 rupees.
That's really sweet. What's the most adventurous thing you have ever done?
I jumped off a cliff in Manali with only a parachute. Of course, the second most adventurous thing I did was, being a surgeon, I started teaching. And thank God to Dr. Bhatia that I took that. There's a very important story I must tell at this moment.
Please.
Because there was a time when we were taking classes in a small school in Hardcore Butler, somewhere in Connaught Place. But one day Dr. Bhatia says that, Dr. Vij, are you interested to go to Jammu? I said, for a class outstation, I was very nervous going out and taking a class. I took a day off, Sunday, and we went for a class. And there was a train which was an overnight Puja Express, it used to be called. It used to go from Delhi. And that train was so full. It was the time around Navratri. It was so full that there was no seat, and I was waitlisted. And Dr. Bhatia said, "Putra, chale ja, baij aayin, then mil jayega baad se. You will get the ticket later. You just get into the train." On the station, I could not even get into the train. It was so full. And I just kept looking for the TT, and he would not listen. You look at the train, you can't even get in. Forget a waiting list getting cleared. So I called up Dr. Bhatia. I said, "Dr. Bhatia, the train is too full." He said, "It's okay. Then maybe we'll cancel it. You can go back." I was walking back. The time was 10 o'clock. The train started moving from the station. I walked back, climbed the overbridge, and I was about to climb down the overbridge and get out of. And I saw the train stopped. Of course, it's because somebody pulled the chain, because there were too many people and somebody must have not gotten. Somebody pulled the chain and the train stopped. And I look at the train, it stopped. And I said, it has stopped for me. This train has stopped for me. I was almost out and I was going back home. I ran back and I got into the last bogie of that train. And thanks to that train which I took that class. I got a seat to even sleep at Ambala. I took that class, and after that I did how many hundreds of classes with Bhatias, and that was the stepping stone of my teaching career. And here I am, podcast with Dr. Bhatia's lovable son.
Thank you so much, sir. I think it's a beautiful story and a beautiful end to our conversation, sir.
Yeah.
I think it was super enlightening, super helpful, and I think you have, got obs and gynae completely untangled for us. So any big word I would like to say would be less for this podcast. It was an amazing experience to sit with you, sir. It was an honor of mine, and I have known you since my childhood. Dr. Vij aa rahe hamare ghar mein is a very known saying in my house. So you have been a family friend, you have been a mentor for so long, you have been a friend to me. So I believe being a friend to you, being a mentee of yours has been a big honor for me, sir. And I continue with your blessings ahead. So thank you so much for being a part of my life. Thank you so much for everything. And I believe, sir, you are one of the best people I know, not just a doctor, one of the best persons I know. So I can proudly say I have a very good friend here.
Thanks so much, Nachiket. That is so sweet of you to say. You actually summed up my feeling when I came here, because like I said in the beginning, it's like coming home whenever I'm in Bhatia's for a class or for a dinner or for an event. And this podcast was lovely. And it brings me to that same feeling which I took the first class, with the blackboards. And we used to have chalk and dusters in our hand. And from there, we're having projectors and we're having iPads and we're having, online classes, we're having satellites. So from that humble beginnings to this, and I've been part of that journey. So that's why I'm proud to be with the Bhatias ever since I started teaching. And thanks to the institute, thanks to Dr. Bhatia, that he gave me the right kind of impetus, because of Bhatias, I never had the urge of doing private practice. That is something which everybody knows, that he's not at all interested in private practice, because in private practice you have a lot of your own goals to meet. But here I'm doing practice, I'm doing a missionary work. I'm so proud that I'm teaching apart from that work. So I'm a very satisfied person. Thanks to Dr. Bhatia.
Thank you so much, sir. Thank you so much. And thank you so much, guys. I believe that you must have loved this podcast. There is not a single speck I would not love it, because I think every word sir has said was super helpful, super enlightening. So I'm sure that you must have liked it. Any friend of yours who is looking to learn more about OBS-GYN as a branch, as a specialty, how to open a private practice, you can very well share this podcast with them. And before you do so, please do subscribe it. We are looking forward to 30,000 subscribers and bringing more legendary doctors to our hot seat. Thank you so much. And don't forget to mention your favorite next guest for a hot seat in the comment section. Thank you so much and best of luck.
Thank you once again. Lovely to be here.